Hello, my name is Jennifer Mahon. I'm the Veterinary Technical Advisor for Duggan Veterinary Supplies. I'm here at home on my own farm in Sligo with my dad to talk a little bit about sheep fertility and the use of synchronisation protocols in sheep. Sheep are seasonal breeders. This means that they naturally cycle in the autumn when daylight hours start to decrease. From a marketing point of view, it is important that there are lambs available to market all year round. This means that a certain proportion of our national flock will need to lamb a little bit earlier than normal in January or December time. To achieve this early lamb production, we need to rely on the use of synchronisation protocols. These use hormones such as progesterone and ECG or PMSG. To justify the cost of doing a synchronisation protocol, we need to be able to achieve a number of targets. These include getting 70% of the ewes that we sponge to conceive and lamb down, achieving a litter size of 1.7 lambs per ewe, and getting 90% of those lambs weaned by 16 weeks of age. To achieve success with any synchronisation protocol, we first need to select ewes that are most suitable for the programme. This involves checking the body condition score of the ewe, checking her teeth, checking her udder, and observing for any signs of lameness. To insert the progesterone sponge into the applicator correctly, we must first make sure that our sponge is faced with the strings facing down. This means that they will be in the correct location outside the sheep after we've inserted. We place the sponge into the bottom of the applicator, and we use the rod that comes with the applicator to push the sponge a little bit further up the device. This means that it is ready for insertion into the sheep. We can then take some lubricant and apply it generously to the top of the device, again to aid in insertion. Once the applicator has been adequately lubricated, it is ready for insertion into the ewe. It's important to angle the applicator upwards for ease of insertion. We take the second piece of the applicator, the rod, to push the sponge a little bit further into the ewe. We remove the entire applicator and lift the tail to check the strings are present. This means the sponge has been inserted correctly. It's recommended that in between each ewe, the applicator is disinfected. As both progesterone sponges for sheep and PMSG or ECG injections are prescription products, your vet can best recommend what kind of protocol will work best for your flock. One protocol that is recommended by Teagasc and quite widely used in Ireland is to insert the sponges on what we'll call day 0 in the morning. The sponges are then removed on day 12 again in the morning, and an injection of our ECG or PMSG is given. The recommended dose for ECG is roughly 500 to 750 international units, but again your vet can best advise on what dose is suitable for your flock. In terms of mating or introduction of the rams to the flock, this depends on whether we are using a synchronisation protocol in mature ewes or hogget ewes. For hogget ewes, the ram can be introduced on day 13 in the afternoon. For mature ewes, we wait until day 14 in the morning for introduction of the ram. It's also important to note that we need to keep our ram to ewe ratio of 1:8 to make sure that all ewes will be covered. To remove the sponge on day 12, pull the strings in a downward motion. When administering the ECG or PMSG injection, we want to give that into the muscle, so normally somewhere here along the rump. Another use of synchronisation protocols in ewes can be as a labour-saving tool to produce a more compact lambing period. We hope to see lambs here on the ground in about 5 months' time.